Shrivel balls will make your Johnson look bigger. True. I would agree with him there. Jon Skywalker said, I definitely think the average young man these days should be on a low dose of testosterone, prescribed by a doctor, of course. If you're worried about health, low test levels probably cause more problems than high test. Do you really think they prescribed seniors and transitioning females with testosterone if it had significant negative impacts on health? Now, what's your excuse? I'll answer some of your questions in the comments. Let's see some of these comments. Word, steroids good. Look at that peak, bro. 9K, I don't know what that means. Average young man probably produces enough tests to be healthy, though. And he replied, male suicide rates have skyrocketed over the past few generations. Why? Mental health issues, depression, lack of purpose, all due to low test levels. I don't know if we can exactly prove that. Be honest, my junk gonna get smaller, even on low doses. Yeah, shrivel balls will make your Johnson look bigger. True. I would agree with him there. People are so upset, cry face, because they slowly realizing some of them got test levels lower than trans chicks. Another cry face. I'll read one more. The best argument one could bring is that the average level of testosterone has drastically declined over centuries, so it would be logical to up it through steroids. However, because of the fact your body's receptors are used to your current level of test, upping it through steroids would be like nuking your body with something you don't even have enough receptors for. Thus, it causes damage through other mechanisms. Although your body sooner or later adapts to the high level of test through creating more receptors, until then you've already done the damage, which might be irreparable. From then on, it'll be like a cat and mouse game trying to balance out your hormones and receptors while not even producing your own testosterone anymore. Just wanted to share this comment since I thought about taking steroids some time ago and did my research, but the risks 100% outweigh the benefits you could get, especially because majority would only do it to get girls like, what the fuck is wrong with you? And he said, I ate cornball. I think that was to him. Yeah. So yeah, I don't know. Let's look at this dude. I don't really know who this guy is. Jon Skywalker. No diss on him. I mean, obviously a lot of people do, and I see some of my friends follow him. 819,000 followers, way cooler than me. Dude looks like Rufio to me. Do you guys know who Rufio is?
No, Mr. Skunkhead with too much moose. You are just a punk kid.
Well, let's see. So I'm guessing he's saying that he's on TRT. I mean, here's the picture of him on this TRT post that he did, and decent arms, decent delts. Chest is kind of small if I'm looking at it from a bodybuilding standpoint. Abs are lean. Arm is decent. I mean, but I'm going to be honest here, like this is not a physique that requires TRT. And I'm going to say that this is my biggest argument with this post. I don't even know. I don't fully disagree with this post, but I also don't agree with it fully either. I'm somewhere in between. I think there's a big philosophical debate here more than anything. But first, let's dive into the science of this. Most guys need, or he's saying the average guy needs testosterone replacement therapy. That is way too broad of a statement. That's like saying all carbohydrates are bad. And I'm sure he would disagree with that. It's kind of stupid. All blanket statements are stupid. So from a medical standpoint, if you have a guy who has a 600 nanogram per deciliter testosterone with 20 nanogram per deciliter free testosterone, do they need TRT? No, because that's the target for TRT. And I see this all the time because their favorite influencer, like this guy here, tells them that they need TRT or that they're on TRT and that's how they got the physique that they have right now. However, their test levels are maybe 500 with a 15 free. That's not terrible. It doesn't necessarily require TRT. Keep in mind, TRT, testosterone replacement therapy, is a medical treatment. It is aiming to get you into normal physiologic ranges. So what is normal? Well, here in the US, normal is defined as around 300 nanograms per deciliter upwards to 950 nanograms per deciliter. Now, I think that lower number is a bit low. I think most guys probably feel better around 500 to 900 or 1,000. So the goal with therapy is to get you within those ranges. Now, there has been zero literature to date showing that within normal ranges, there's any difference in gains with testosterone levels that are within those ranges. So let's say we have a 500 testosterone and 800 testosterone. There's nothing to say that the guy with the 800 testosterone will make better gains than the guy with 500 testosterone. In fact, due to normal fluctuations, that guy with 500 testosterone likely sometimes has 800 testosterone. It's not uncommon for testosterone to fluctuate 100 to 300 points on a day-to-day basis. So medically, do these guys need TRT? I'm going to say no. Now, next example, a guy comes in, he has around a 300 testosterone. Does he need TRT? Well, maybe, but I think it would be irresponsible to not figure out why does this guy have such low levels? What's his sleep like? What's his training like? Is he getting adequate nutrition? Is he getting adequate hydration? We should even go deeper and figure out what's his social life like. How is relationships? How is his stress level? Etc., etc., etc. Now, if this guy's being true with himself and all of these things are dialed in, which I truly doubt they are all dialed in because almost none of us have all of these things dialed in. But if this guy has everything dialed in and his levels are still coming up low, then maybe let's consider it. That is when there's probably a true medical need to get him within normal physiologic ranges. Will this guy have the ability to make better gains? Yes, but his gains have not now become steroid level gains. They've become baseline gains. Again, TRT brings you to baseline, normal physiologic range. Guys like this conflate it with steroids. TRT is not steroids and will not give you steroid-like gains, I promise you. Now to his point on the health effects of testosterone. This one I don't necessarily fully disagree with him on. He says low testosterone may be more detrimental for your health than higher testosterone. Again, too much of a blanket statement. There's nuance here, so it's yes and no. How high are we talking? Are we talking upper end of normal, like 1,000 nanograms per deciliter to 1,200 nanograms per deciliter, and comparing that to around 200 nanograms per deciliter? Then okay, I would agree with them. There's a decent body of literature that shows that hypogonadism or low testosterone, let's say below 300, is correlated with negative health outcomes. I have not seen data that shows that the upper end of normal is correlated with negative health outcomes, so there I'm going to give it to him. But he said high testosterone, and I think that we need to dive into this a little bit. So let's call high testosterone above 1,500. I think for sure we know that there are negative health outcomes when we bring androgens too high. And I'm not talking about any of the aesthetic health outcomes. I don't give a shit about acne. I don't care about hair loss. I don't care about oily skin. I don't care about gyno. Those to me are not negative health outcomes. Those really don't impact your health much. I care about actual negative health outcomes like upregulating the renin-angiotensin-aldosterone system, causing blood pressure to be elevated. I care about negative health outcomes like that increased blood pressure causing renal issues. I care about negative health outcomes like increased oxidative stress, increased neurodegeneration, left ventricular hypertrophy. These things do concern me, and these are things that we do see in high androgen use. Like most things, too little of testosterone, not good. Too high of testosterone, not good. There is a sweet spot. Where that sweet spot is going to differ from individual to individual. Some guys feel completely fine with a 400 testosterone. They've got good libido, they're putting on muscle, they're recovering okay, they have no brain fog, everything's fine. Other guys may require 6, 7, 800 to feel the same way. But another huge misconception is that more testosterone is always good. I just talked about the negative health outcomes of testosterone, but also subjectively, it can kind of fuck you up when your testosterone's way too high. Having levels that are too high can lead to sympathetic overdrive, meaning your sympathetic or your fight or flight nervous system is basically all revved up. What that equates to is poor sleep, anxiety, irritability, anxiousness, and every guy cares about their libido and their sexual performance. Well, if you're all revved up, sympathetically overdriven, your libido is going to be shit. You're not wanting to procreate when you're in fight or flight. Sex is a very interesting combination of both the parasympathetic and the sympathetic nervous system coming together in perfect harmony. But if one outweighs the other, your libido is going to be trash. So I think we've concluded, at least from a medical standpoint, that not every guy needs TRT, and that when looking at health outcomes, higher testosterone isn't necessarily always better than lower testosterone. And hopefully I've imparted the fact that TRT does not equate steroids. They are completely different. We need to stop conflating them. Now let's move on to more of the philosophical discussion here, which is, should every guy be enhanced to some extent? Well, maybe. I mean, for myself personally, I'm totally into transhumanism, meaning whatever I can do to make myself a little bit better, I will do, to an extent that is. So is there an argument to be made that TRT can benefit one's life even if they fall within normal physiologic range? I think there is. My one argument for that would be going back to earlier when I said testosterone levels fluctuate a lot. The guy with the 500 may have 800 at some times. And then with that same reasoning, he could potentially have 200 if we're saying that it can fluctuate 300 points in either direction. So with that, if you're trying to be optimal all the time, as a natural, you just aren't going to be by nature of just the way that your hormones fluctuate. However, with properly dosed TRT, theoretically, you could kind of be 24/7 in the optimal range, meaning your testosterone will fluctuate by being 800 sometimes, then dipping, being 500, maybe spiking, being 800 again. Instead, maybe you can get it to 800 24/7 and always be in a good area. So yes, I think that argument is there. Now, is that optimal? I don't know. Is there a reason that either evolution or a creator thought that we would benefit from having these diurnal fluctuations? I don't know. Would there be downside to chronically suppressing your testicular function, to chronically suppressing your luteinizing hormone and follicle stimulating hormone production? I don't know. These are questions we really haven't figured out yet. I think if you fall into the category of everything should be natural and the way that our ancestors did things and the way that was naturally intended, then TRT is not for you. Now, if you fall into the category of, like me, very interested in transhumanism and utilizing science to the best of our ability to be better than our ancestors were, to be better than we are, then maybe TRT is for you. I can't tell you. I don't think anyone can tell you. I don't think science has demonstrated yet which is better. Is it the transhumanism, the optimism crowd, or is it the natural crowd? I don't know. Like all things, I'm sure it lays somewhere in between. So to wrap up my thoughts on Rufio's quote here, by the way, when I call him Rufio, this is not a diss. I freaking loved Hook when I was younger, and Rufio was the shit, and this dude's look is badass, and so I'm not hating on him. And when I say that he doesn't need the gear to obtain that physique, that's also not hating on him. I'm just simply putting that out there. He's not super massive to where he would require any crazy amount of drugs. So I'm just putting that out there. No diss on the guy. I don't know the guy. This is not a diss channel. I fucking hate haters. So just letting that be known. I don't fully disagree or agree with him. I think there's some validity to what he's saying. I think it's slightly misguided. I don't think that if I had that kind of platform that I would put that out there. In fact, this is just something of note that I noticed. When I clicked to see who liked it, I saw that one of my clients had liked the post. Now, this client is young. He's only around 18 years old. He battles with a severe eating disorder. And when he came to me first for our first consultation, he thought for sure that he needed testosterone. And I was finally able to tease it out of him that he has a very serious eating disorder. He suffers from anorexia, and he's a purging type, meaning that he cares a lot about his physique. He tries to be as skinny as possible, and he makes himself throw up to do so. So obviously, testosterone was not this kid's problem. He has psychological issues that he's dealing with. He has this actual disease and anorexia that he's dealing with. Adding testosterone in there would not help. And before you think that it might, let me just comment on my experience with that. I was somebody who also dealt with anorexia as a kid because I never felt like I was good enough. So I got into fitness, which kind of helped me, but then I fell into bigorexia. And what did I do? I hopped on steroids. Steroids did not help me. I didn't get any more confident with my body image. I just went the other direction. So testosterone and anabolic steroids only made things worse, honestly, because I got to a point where I was abusing the shit and I was using way too much to chase a newer body image. I no longer just wanted to be skinny. I now wanted to be jacked and shredded. And so putting testosterone into this kid who had normal physiologic levels would not have fixed anything. Back to the story, when I clicked to see who liked this, that kid who I follow and I'm friends with liked that. So there's kids out there like that are seeing people like him saying that everybody needs TRT. And this is influencing the way that these kids behave. They're also thinking that guys like him look that way because of TRT. They're inappropriately hopping on TRT at way too young of an age when there's not a need. And since they're just doing TRT doses, they're not going to make many more gains than they otherwise would have. They're going to be disappointed, and they're going to continue to progress and move on and do harder and harder drugs just like I did, trying to achieve some unrealistic light that these guys are getting through awesome downlighting and Photoshop, etc. So yes, statements like this, though I'm sure was well-intended, can have negative outcomes and can be harmful for a lot of people. At the end of the day, I'm highly libertarian. Do whatever the hell that you want to do. But to make claims like everybody needs, everybody should, always, 100%, definitely, are almost never true. You shouldn't listen to things that are just blank statements. There's always a bit of nuance. That's the end of my rant for today. I think this memory card's about done, so I'm going to end it there. See you guys.